close that chapter of your life. To recover and move on from Mindbody Syndrome, neuroplastic symptoms, you need to close that chapter of your life. You know the one that I'm talking about, that horrible, awful one. The crisis, the chaos, the panic, the fear, the severe and extreme and persistent symptoms that you tried to figure out, to fix, and you went to medical provider after medical provider and tried treatment after treatment. Even if you still have symptoms, try to close that chapter of your life of when they started, when they were the most severe. It will help you feel like a normal and healthy person again. And changing that mindset will help your symptoms fade over time. For me, 2024 and early 2025 was absolute hell. It was a nightmare. It was filled with endless doctor's appointments, like multiple doctor's appointments a week. Seeing new specialists, having so much testing, imaging, physical therapy, treatments. I kept getting new symptoms, and it seemed like they happened in like every single bodily system that they could happen. Where for the first 4 decades of my life, I had no medical diagnosis or conditions. It is unfortunately not an unusual story. I had some pretty horrific encounters with medical providers, but you know what? I had some absolutely wonderful ones that were there for me and cheered me on. I did even have a few that thought I could recover. And my physical therapists, they were like my mental health therapists. They spent hours talking to me. Many were calming and reassuring when I was in absolute crisis, where it was not unusual for me to show up with a brand new problem every month. If they were rolling their eyes, they didn't make it obvious. As I've mentioned in a few other of my videos, I am moving to Florida next week. Yay! Living the dream. I am so excited. So if you're watching this in the future, I might already be there. And I'm definitely going to do also a future video about how that played into my TMS recovery. But now back to the topic at hand. This move has given me a great opportunity to reflect on my life here in Michigan, to close a difficult chapter, which was the worst year of my life, by far, times 1,000 bajillion million. There are the inevitable goodbyes that need to be said, and this goes for my medical providers too. After my severe TMS onset in the spring of 2024, I did eventually find some providers that truly helped me. None of the people I started out with stayed. No way. I got a new sports medicine doctor, a new physical therapist, a new neurologist, and they were kind and smart and they wanted to help. Sure, eventually, once I learned I had TMS, I realized I didn't need physical therapy anymore. I didn't need to go back to sports medicine for another MRI of whatever new pain developed. So I stopped seeing them. As a psychiatric nurse practitioner, I've had a lot of patients that have fallen out of treatment, and I'll think of them and I'll hope that they're doing okay. And a lot of times you just never know. I didn't want my providers to think of me oh, what happened to her? Oh, maybe she really could never run again. Or maybe she got so embarrassed about coming back to PT for all her 10 fake injuries that she had over the course of the year that she just, went into a new practice and was I can't go there anymore. They're going to think I'm crazy. I wanted my providers to know of my success story. And even though they used the traditional medical model, they did help me immensely, even if it was just for that reassurance and psychosocial support. So over the last month or so, I've been saying goodbye to my medical providers, even if I haven't seen them in over a year. I said goodbye to my gynecologist, who was really so compassionate when I was having all of my pelvic issues early on. I went back to one of my surgeons who, again, I went into crisis multiple times after that surgery, and he just never made me feel crazy. I said goodbye to my sports medicine team and told them all of my running successes that I had had. And I went back to my physical therapist, who spent so much time with me, hours and hours. Even though I avoid PT like the plague right now, and I celebrate every month sober from PT, they were there for me in my darkest hours. I will never forget what one of them said to me when I had just literally stopped using the mobility scooter a few days prior, and I could still barely walk, and I had the ankle brace, and it was still barely doing anything. He said, "You will come back from this. People have come back from worse." I did not believe him at all. Not at all. I was I have it the worst out of anybody. I have a brain that tells me that I can't run anymore. And I have so many pains and so many problems now. I'm just never going to get back to it. This isn't some typical, like, normal injury. But, like, he was totally right. He was totally right. It was 2 years ago, almost to the day, maybe to the day. 2 years ago, he said that to me. And I'll never forget it. And I'm so appreciative of him for saying that. So appreciative of him. You don't need to move across the country like me to close a chapter on your life. And maybe you don't really have a history of great experience with any providers. Honestly, I think I lucked out. But I bet you can find someone that was a caring ear. Maybe it was your provider's nurse or medical assistant. Maybe it was your pharmacist helping you figure out all your medications. Maybe it was the lady at the front desk, because I'll tell you, I had some office staff that like went to bat for me. They like heard my story and they like got me in when I had no business getting an appointment that soon. Like, they saved my life back then. They really did. They really did. I was so terrified, and they were fantastic. Maybe it was the MRI tech who heard your symptoms. I had one once, and this was before I got my first brain MRI, and I told her all my symptoms, and the look on her face, she like literally thought I was gonna die tomorrow. Like, oh, I wish I knew who she was, because I would go back and tell her, like, yes, I had all those symptoms, but there was nothing wrong with me, and I don't have any of those symptoms anymore. I'm totally fine, and I'll live. But wow, yeah, that was an experience. That was an experience. I went in person and thanked them. It was really hard. And I was very anxious and shaking and panicky and freaking out, and there were definitely tears. But it felt good. It was closure. But you don't have to do that. You could write them a message on your portal, or you could send them a card. Maybe with some, you'll let them know the fact that you understand now the cause of your symptoms. I mean, I didn't go all like Sarno and Freud on people, but like I did let them know that like, okay, I've understood that this is stress-induced and that I have a highly sensitized nervous system that is highly reactive, and that they seem to understand. I didn't get into the war of the id and the superego and the unconscious rage, but doesn't mean I don't believe it. Doesn't mean I don't believe it. Maybe if you do that, you will not only feel some closure, but maybe you will pay it forward, because maybe your providers in the future will see someone like you. Well, no, they probably already see a bunch of people like you, because we know how prevalent TMS symptoms are. But maybe in the future, if there's someone that shows up in crisis, not understanding what is going on with his or her body, and in so much fear, and it doesn't match up to anything truly medical or physical, they'll think back to you. They'll think back to that old patient who had all of these symptoms and who recovered by just acknowledging that the symptoms were coming from the brain. What did I miss? Comment below if you've ever done anything to close that chapter in your life. And even though you might feel that you are not even well on your way yet to your own TMS success story, you are. And doing something like this is gonna further set yourself separate from that past history of yours and change your mindset to someone who is really living the identity of a healthy and normal person again, because you are. You are. Close that chapter on your life, people. Thanks for watching. You are well on your way. Please hit like or subscribe, and I'll see you in the next one.